Hi, it's Steph here. Welcome back to my channel. Do you feel like you're not progressing in your career and are not learning anymore in your job? Or maybe you're a new pharmacy grad and overwhelmed by the amount of things that you need to learn that you're experiencing a learning block. As I reflect back on my experience and journey as a pharmacist as a new grad until now, I've compiled these advices that can hopefully help you in propelling your personal and professional growth as a pharmacist. My number one advice to you is always follow up on your patients. You can learn so much from your patients just by talking to them and following up with them. Although it is required that we do so for best practices, but view this as a learning opportunity as well. By doing so, you can then see the actual impact of the drug and the dose on the patient. This can apply to both effectiveness and safety endpoints. To monitor a patient for the effectiveness of therapy, obviously you want a drug that you're able to monitor the effects for. For example, if your patient is on a blood pressure medication like ramipril and their dose has been increased from 5 milligrams to 7.5 milligrams, figuring out when we should start to see the onset of this dose increase and asking them how this has affected their blood pressure will give you an idea of how much a 2.5 milligram increase from 5 to 7.5 milligrams would affect their blood pressure. And obviously, learning from your patients is not something that school and textbooks can teach you. So your patients are a very valuable teacher. In terms of safety endpoints, talking to your patients can also help you figure out common side effects that your patients may encounter after they're started on medication therapy. For example, with Paxlovid therapy, it was after speaking and following up with our patients do we learn that it often leaves this metallic taste in their mouth. Another classic effectiveness example is warfarin monitoring. By monitoring our patients' warfarin doses and the impact on their INR, we can then see how these dose increases impact their INR. And if you ask the right questions, we can potentially also figure out how a bowl of salad or a big cup of spinach smoothie can also affect their INRs. My second advice for you is to find a mentor at work. This could be a more experienced or seasoned pharmacy colleague or another healthcare provider on your team who is willing to guide you and provide you with feedback. For example, when I first started as a new pharmacist at my first hospital, I was very fortunate to have encountered a nurse practitioner and a seasoned pharmacist who were willing to be my mentors. Through them, I've learned how to draft business cases, to advocate for initiatives in our pharmacy department. I've learned to conduct research projects and, with their encouragement, presented at national conferences, and have also learned how to effectively facilitate and present at leadership meetings. My third advice for you relates to your mindset. Always keep an open mind and be curious. Be open to new perspectives and ideas as well as ways of doing things. You never know if there's a better way of approaching a situation unless you are open to others' feedback. This will allow you to be more adaptable to change and to new environments. By being open-minded as well, it also allows you to embrace others' views that may not be consistent with your own, which if you're open to, may serve as a catalyst for personal growth and change. My fourth advice to you is to view errors that you've made and challenges as an opportunity to learn rather than barriers for growth. By tackling your challenges head on rather than avoid them, such as asking for feedback, talk to people, do your research, and do some deep reflection, this is when you'll really grow. And everybody is prone to making mistakes. It's part of being a human being. So rather than adopting the mindset of giving up whenever a mistake happens, reflect back on it and make a plan on how to avoid this in the future. My final advice for you is to reflect daily. It could be a 5-minute habit that you adopt every night where you reflect on your day. Reflect on what went well, what could have gone better, and how you can further improve if you encounter the same situation in the future if you weren't happy with how you dealt with it this time. Reflection won't be helpful unless you implement them. So make sure to implement what you've reflected on and plan for yourself going forward right away. If you found these advices helpful, please subscribe to my channel. I do make videos every week on pharmacy and practice-related topics as I progress through my pharmacy journey. I hope to see you in my next video, and thank you as always for your support. Bye for now.